Oral questions by members.
Leader of the Official Opposition.
Well, thank you, Mr. Speaker. We have known for months that sick pay would help prevent workplace outbreaks during the pandemic. And one thing I know we can all agree on in this House is that British Columbians are going to do whatever it takes to take care of their families, even if that means going to work when they're not feeling well. We also know that lack of paid sick leave disproportionately impacts frontline workers, marginalized workers, and 20 to 39-year-olds. But so far, all we've seen from this Premier is bungling and delay. Yesterday, the Premier finally promised that a sick pay program will be introduced, but this comes 14 months into the pandemic. And in fact, a year after the Premier promised a provincial program and in fact told everyone, we've got a plan, we're ready to go. Can the Premier today provide some details? How many sick days will be available to workers, and how will the program be funded?
Minister of Labour.
Thank you, Honourable Chair. Mr. Speaker, I'm happy to answer this question, and I thank the Leader of the Opposition for asking this question. And one thing, it is clear, we all agree that when the workers are sick, they should not have to go to work. It's good for the workers' health and safety, their families, and it is good for the businesses so that we can stop the transmission of COVID at workplaces. Mr. Speaker, we made a number of changes to support the workers, to support them when they're sick, they have to stay home. First, we brought in legislation, so we made changes to the employment standard so that they don't lose their job if they decide to stay home when they're sick. Then, Mr. Speaker, we are the only jurisdiction in Canada that provide benefits if the workers become sick at workplace with COVID from day one, as long as they're sick, Mr. Speaker. And now recently we have passed legislation so that the workers will have time to go get vaccinated without loss of pay. We've been working with the federal government. I'm proud of the work that the Premier has done working with the federal government to ensure there's a national solution to this program. Mr. Speaker, we had the indication they will fix the gaps that were brought to the attention by me, by Premier, by others. They failed to do that. Now it's up to us. We will have a Made in BC sick benefit program so that all workers will be brought up, and I'm happy that the opposition will be supporting us with that.
Leader of the Official Opposition on supplemental.
Well, thank you very much to the Minister of Labour, and the way that he wandered his way through the answer, he studiously avoided the specific question. And let's be clear, while we do believe that a national program is important, what matters today and what mattered 14 months ago is making sure that British Columbians are taken care of and that there is a paid sick leave program in place. So let's just remind the members opposite, the Premier delayed, and then what did he do? He blamed the federal government for their broken promise. Well, welcome to how British Columbians feel about the growing list of broken promises from this Premier. The time for trust me has passed. That's what the Premier said. I'm going to put a sick pay program in place. And by the way, I've got a plan to do it. Here we sit, 14 months later, no sign of anything. Workers, and more importantly, employees, need to know how the program would work. The Premier said he had a program, so let's hear about the details. I also want to remind the members opposite of what the Premier said about who should pay for it, because that's going to be a very critical point of discussion when we finally see legislation. Here's what the Premier said, and I quote, "We'll do it in a seamless way without putting more burden on businesses at a time when businesses can least afford it." So we can set that worry aside today with one answer from the Premier. Will he get up today and confirm that the program he intends to introduce will be completely funded out of the $3.1 billion contingency fund, and that these costs will not be transferred to already struggling businesses in British Columbia?
Minister of Labour.
Thank you, Honourable Chair. Mr. Speaker, I really want to emphasize here that The workers of British Columbia are proud of the work that their government has done to support them, pre-pandemic, during pandemic, Mr. Speaker. We brought changes to support them. Mr. Speaker, at the same time, we weren't sitting idly by. Premier, myself, other colleagues of our government were working with the federal government to fix the gaps that they left behind. And we had the indication that they would do it. That was about a week ago, Mr. Speaker. And now it is up to us. We will have a Made in BC program as a sick leave program. Details the member can debate and other members can debate when they are before the House, Mr. Speaker. A lot have changed during this pandemic, Mr. Speaker. I hope that the BC Liberals' attitudes toward the BC workers is one of them. I have not seen one yet, Mr. Speaker. Hypocrisy oozes out of these members, Mr. Speaker, when you look at their track record. British Columbia workers know that this government has their back. We will continue to work to support them, Mr. Speaker. Details will be coming in coming days, and I'm looking forward for this member and her caucus to support us.
Thank you. Member for Shuswap.
Well, Mr. Speaker, let's be clear that this government and this minister stalled on the implementation of the paid leave program for vaccinations for over 14 months. And here we are today in the legislature, and again, we're not getting clear answers from this minister. With over $3 billion currently sitting in the Pandemic Contingency Fund, there's no reason why the Premier cannot commit today to providing the money to help sick workers in British Columbia. This is a public health emergency, and costs for public health should not be put on the backs of employers, either directly or indirectly through WorkSafe BC surplus and premiums. Through you, Mr. Speaker, to the Premier, will he commit that government will cover the full cost of the program for as long as it's in place?
Minister of Labour.
Honourable Speaker, as I said before, since the outset of this pandemic, we have led the way in pushing for and developing increased support for workers so that they don't have to go to work when they're sick, so that they don't have to choose between paycheck and staying home sick, Mr. Speaker. They deserve nothing less. We have been working hard for 14 months now, working with the federal government, bringing our own programs in place. I have listed a number of them, Mr. Speaker, and we are working with the federal government. Federal government failed to deliver to fill the gaps that we identified for them because there are gaps in there. And they do not help when workers have to stay home when they're sick because they will be losing money. Mr. Speaker, more needs to be done, and I can assure this House that we will have Made in BC's sick pay plan, and I'm hoping that the opposition will be supporting us there.
Member for Shuswap on supplemental.
Thank you, Mr. Speaker. It's been a year since the Premier promised that he had plans for a provincial program, and British Columbians need to hear the details of what specific those government plans are. Today, in Ontario, 20 to 39-year-olds are waking up knowing that they don't have to choose between rent or going to work sick. In BC, the Premier is blowing it for them. Will the Premier use the over $3 million in pandemic contingency funds to cover the full cost for as long as the sick pay program is in place?
Minister of Labour.
Mr. Speaker, let's be clear. This member and all BC Liberals never missed an opportunity to trample on workers' rights when they had the opportunity. Mr. Speaker, we are going to support workers. We supported them pre-pandemic. We are supporting them now. And they know that their government will continue to support past pandemic, Mr. Speaker. Our track record is clear that we're on the side of the workers. We understand it's the workers and employer working together that move the economy. Unlike the previous government, they took sides. They showed nothing but contempt towards the working people, Mr. Speaker. The history is full of their track record. And you know what, Mr. Speaker? Workers know These are crocodile tears that they're watching. They know when it is crocodile tears, Mr. Speaker. They worry, actually, Mr. Speaker, when BC Liberals, any member of them stand up in the House or outside, talk about workers' rights. They worry that they are coming after their rights, Mr. Speaker. They know that this government is on their side. We will protect them because they deserve nothing less from their government.
Member for Saanich North and the Islands.
Thank you, Mr. Speaker. When the supportive housing development at Prosser Road in central Saanich was announced, there was very little information made available to the public. That was a month ago. I first heard about the project in the media at the time of the announcement and just had my first briefing this week. There are many questions still to be answered. For the last month, the fear and anxiety in the community has been increasing, and where information lacks, people are filling the gaps on their own. Every day, this government is losing ground, not just in the neighborhood, but also for the potential future residents of this project. This project was supposed to help marginalized people. Instead, the process has further stigmatized people who do not need more obstacles put in their way. We are not in the business. Thank you to the Minister of Social Development and Poverty Reduction. Appreciate it. Yeah, you're a minister. We're not just in the business of building housing units, but rather we should be committed to nurturing community. Our effort must be more than just buying hotels and dropping units in the ground. The government must do the difficult work of building neighborhoods. My question is to the minister responsible for housing. Does he believe the process his ministry has undertaken in central Saanich has created a safe and supportive atmosphere for the surrounding neighborhood and the future residents of his project?
Attorney General.
Thank you very much, Honourable Speaker. I look to all members in this House when government is opening new housing for vulnerable people to work with us to address misconceptions, to address myths and concerns, but also when there are real problems, to bring them to our attention so that we can address them. I don't pretend for a second that this is not incredibly challenging work and that there will not be problems. Sure, there will be problems, but all of us have to work together to address them. The member talks about building neighborhoods, building community. I heard in his 2-minute statement talk about even before a single person has been identified to move into this building, the impact that it is going to have on the surrounding community. The data shows really clearly, when you look at the most obvious metric about what an impact of a supportive housing unit would be, the impact on the value of housing around it, the price people are willing to pay to move next door to one of these units, the values are not impacted. When people are voting with their dollars where they want to live, they're happy to live beside supportive housing because it works. It doesn't mean that there are never problems. It doesn't mean we don't have to work together to address them. But even before a single person is identified to talk about the impact, that's not helpful. So I'm asking the member to work with me. I'm glad to work with him. He had his briefing to get people inside, to get them good, high quality housing out of tents. This is our priority. We're in reactive mode right now. We're moving into proactive mode with a homelessness strategy. I will need his support and I'm counting on it.
Member for Saanich North and Member for Saanich North and Islands on supplemental.
Thank you, Mr. Speaker, and I appreciate the minister's response. However, I think it needs to be pointed out that had the minister truly wanted to have my support on this project, he would have offered me an opportunity to learn about the project that they were proposing in advance of making the announcement. If this minister has his arms truly open, he would have had that conversation with us in advance so that we could have learned about exactly what is going to be built in the neighborhood. I am, and this government knows, and there need not be any suggestion otherwise, that I'm anything less than supportive of supported housing. This is the work that I've been doing along with my colleagues on the other side over the last 4.5 years. So it's absurd to suggest anything otherwise. This is the exact kind of stigmatization that happens. You raise questions about this, and you get called, you get suggested that you're opposed to it. The reality of it is that the neighborhood is filling in the gaps on their own because the information is not forthcoming. We know that when we're building communities, information flow is critically important. My question, you can continue to chirp me all you want, Minister. My question is to the Honourable...
Member, continue. Member, please continue. Members will come to order. Member.
What is the minister going to do to accommodate the needs of the neighbourhood, regain the confidence of the community that he's proposing a project in? And of course, these projects need to go in communities, and I support that. And I support diversity. I support inclusion. The suggestion otherwise is ridiculous. What are we going to do in order to prepare the way for the proposed future residents of this community and this neighborhood to feel welcome? Because the gap has already been created in a month-long situation where there's been a lack of information, Mr. Speaker.
Attorney General.
Thank you very much, Mr. Chair. And the member should note who's cheering along with him. The members of the opposition who built this crisis, who said that addressing homelessness through units that they were providing, the units they were providing were mats on the floor. So just the member should be aware of who's cheering along with him in his questions today. This housing is supportive housing. There's a challenge. It's a new project. There needs to be community engagement. BC Housing is doing that community engagement. Service providers haven't been chosen. Residents haven't been chosen. The engagement is a legitimate engagement with the community. So you have to announce that the project is coming before you can engage on it. And to suggest that we would just show up and say, oh, here's exactly what's going to happen. We're going to engage, but we've already made the decisions, would be problematic. The member wants all the information in advance. The information doesn't exist yet. BC Housing is still building it. We're moving as quickly as we can to get people into real supportive housing. And I know that the member and I agree on this. That's why I'm frustrated in some respects with the tone of his question and some of his suggestions, because we're on the same page. We want to get people into good quality supportive housing. And that's what builds neighborhoods and communities.
Members.
That's what makes a difference. It's not mats on the floor. And if the members on the opposition are cheering along with you, member, that should be a yellow flag.
Member for Kelowna Mission.
Thank you, Honourable Speaker. The Premier's pop-up clinics are somewhat out of Hunger Games. Take the words of Pavan Dhaliwal from Surrey, and I quote, "Is this real life? Or is this a third world country? This is not Canada, where we have come to a park to line up like this," end quote. The Premier claimed yesterday that he couldn't interfere. Well, the confusion, anger, and the lineups continue today in Surrey. Will the Premier stand up and apologize for the chaos that he's caused communities like Surrey?
Minister of Health.
Thank you very much, Honourable Speaker, and thank you to the member for her question. The member will know that we identified community health service areas around BC in the last 2 weeks where there was a high level of transmission of COVID-19 and a low level of immunization. Those communities included communities such as in the Columbia Valley, in Dawson Creek, and of course, in the community of Surrey. And different health authorities have tried different strategies to address the situation. Over the last couple of days in Surrey and in Coquitlam, Fraser Health worked with pop-up clinics. Now, they immunized a lot of people in those clinics, but I think it's fair to say that they were not a success, certainly from a communications or a confidence perspective. So Fraser Health is taking the lessons from that. But I just remind everybody that more than 1,700,000 immunizations have taken place. Very precisely, people who are clinically vulnerable have been immunized, that we're working through, especially in high transmission areas, frontline workers who are getting immunized as well. I think our program overall has been very successful, and I think acknowledged as such. These pop-up clinics have not been successful because they've undermined confidence in the process while immunizing a lot of people in critical neighborhoods. We've got to learn the lessons, and we've got to do better, and Fraser Health will do so.
Member for Kelowna Mission on supplemental.
Thank you, Mr. Speaker. Well, I do appreciate that the Minister of Health suggested that the vaccinations that we did yesterday were a success, but taking a hotspot with the highest levels of virus, gathering thousands of people, and then waiting them in lineups and congregating for hours, but not getting their vaccines is somehow less than a success. And this morning, hundreds of people lined up again for a pop-up clinic that wasn't actually in existence at Newton Athletic Park. The Premier has already the contact information and postal codes through the vaccine registry. He could have prevented this. And I'll go on to say that there's actually pharmacies that could have distributed the vaccines equally, if not more effectively. One person in line said, and I quote, "My cousin knew someone in Fraser Health and they said they might be here today, so we just showed up. There's still no information around whether you're getting a vaccine," and I end quote. So why is the Premier not using the vaccine registry that people were told to use?
Minister of Health.
Well, the honorable member, the answer is we are, and we did in this case, but that the communications, obviously, of the pop-up clinics led to long lineups yesterday that everybody saw. And so Fraser Health is learning the lessons from that and making changes in their approach to that. And that seems fair enough. The registry has been profoundly successful. 2 million people registered, more than 900,000 appointments booked. And we are going to continue to use that system. And I want to encourage everyone, because there will be more vaccine next week and more vaccine the week after. 1.1 million doses of Pfizer vaccine over 4 weeks to get registered now. It is essential that people get themselves registered so that the first possible moment they can book their appointments. Last night, people who are 58, born in 1963 or before, were able to book their appointments. And those age groups are going to move down through the age-based program quickly over the next 2 to 3 weeks. So I want to encourage all MLAs to encourage their constituents to get registered for the COVID-19 vaccine. This is a crucial moment in the pandemic. 38% of people have been vaccinated up to now, and we're going to do significantly more in the month of May.
Thank you. Member for West Vancouver, Capilano.
Thank you, Mr. Speaker. Mr. Speaker, seniors and people with English as a second language are being left behind by this Premier's pop-up vaccine clinics. One person in Surrey said, and I quote, "We just registered an auntie and uncle who don't have cell phones and who didn't know how to register, so we hand wrote down all the information for them," end quote. The Hunger Games approach is unacceptable. Mr. Speaker, will the Premier ensure that there is proper advance notice of these clinics with proper translation services?
Minister of Health.
Well, thank you, Honourable Speaker. And there are 2 ways to register. One is online, and the other is through the telephone line where translation is available. This is how we immunized 180,000 clinically vulnerable people. In the honourable member's constituency, 45% of people have been immunized in this period when we've had a relatively limited supply of vaccine. And I think that reflects in her community and other communities around BC the extraordinary work of doctors and nurses and everyone else in immunizing British Columbia. Our registration system has been very effective so far. More than 80% of people over 70 have been immunized so far in BC, more than 60% of people over 60 on a program that was fundamentally aimed at people who were older and more vulnerable to COVID-19, people who are clinically vulnerable, 180,000 of them and more, and Indigenous people. And those programs have continued to be successful. And I'd encourage the member to encourage her constituents to get registered, and they will be given the opportunity to book at the soonest possible moment.
Member for West Vancouver, Capilano on supplemental.
Thank you, Mr. Speaker. The pop-up vaccine clinic we referenced was in the Minister of Labour's own riding. You think he would have done a better job ensuring Surrey constituents had the information they needed, including properly translated materials. Here's what they said, quote, "I wish they had it more organized," end quote. Mr. Speaker, what is the Premier doing to ensure local communities have properly translated materials in advance of these pop-up clinics?
Minister of Health.
Thank you very much, Honourable Speaker, and I thank the member for her ideas and suggestions. It's important that we deliver services so that people understand them, and it's why translation services are available and materials are available in multiple languages. With respect to Surrey, we've given Surrey priority in some important ways. All education workers in Surrey immunized, frontline workers in Surrey immunized, and we're moving on to other groups of workers such as childcare workers and others to support our effort in Surrey. It is different in different communities. And we've worked with people in communities such as Dawson Creek, where there was high levels of transmission, low levels of immunization. And now Dawson Creek has returned to close to the provincial average in terms of immunization. We've worked with members of this House with respect to the Columbia Valley and Revelstoke to see the same thing happen in Prince Rupert and other communities. So I think the immunization effort is in British Columbia overall going very well. Sometimes we try things and they're not successful, and we may learn the lessons and move on. And that is the case with respect to pop-up clinics in Fraser Health.
Official House Leader.
Thank you, Mr. Speaker. Well, it's now day 11 since the Premier bungled his announcement about travel restrictions, and there's still no clarity for people trying to travel across the boundaries, what they will or will not be needed to provide to continue on their travels. And yesterday, the Solicitor General and the Premier had a good laugh after our last question around this, but it's a serious matter. If you're traveling from Northern Health or Interior Health or Island Health to take your child to Children's Hospital for a medical appointment that you've been waiting for to see a specialist for the last 4 or 5 months, you kind of want to know what you can do on Monday or not legally. You kind of want to know if you get stopped at a checkpoint and the police officer doesn't agree with why you're going, do you get a $575 fine, pay the premium to the Crown, and get to go on to your medical appointment for your child, or do you get turned around and your child misses their medical appointment? So can the Solicitor General confirm what type of documentation will people need to provide to be able to prove to police officers who otherwise have to make a sole judgment at the side of the highway whether those people can continue on for their medical treatments or not?
Solicitor General.
Thank you, Honourable Speaker. And I'd like to make it clear to the Honourable Member that when the announcement was made on last Friday, and the details I said were about enforcement were coming out later this week, and I know that his caucus was briefed on that, we also made it clear that essential travel is absolutely included. And if the member would let me finish, it was made clear then that when you're going to a medical appointment, it is essential travel, and you do not have to approve. And that has been made clear right from day one.
Member for Surrey White Rock.
Thank you, Mr. Speaker. 158. That's the number of overdose deaths last month. That ties the highest March ever. Tina Clipston is worried her son might be on that list next month, and she's fighting to get him the support he needs. It took 3 days of phone calls by the mom before her son was finally put on methadone. Quote, "When we finally got there, they did not take the intake, but we were told to come back another day to get his prescription. It's not Interior Health's fault. They're stretched thin, too thin. But where else do they go for help?" Mr. Speaker, what we're getting from this government month after month in their news releases is cut and paste answers. We're seeing that from this Minister of Mental Health and Addictions. We are seeing in Quesnel 17 lives lost this year. Maple Ridge has lost 38. Nanaimo has lost 42. And in Surrey, in the last 7 days, we've seen 7 deaths. These cut and paste news releases are not good enough from this government. My question is to the Premier. What is this government's plan to ensure that this mother and other mothers don't have to see their sons or daughters in next month's news release?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. To have lost another 158 British Columbians to the toxic, increasingly toxic drug supply this past month is tragic. I express on behalf of the government my condolences to the family, the friends, the peers, and everybody working on the front line who's worked so hard to keep people alive. This is a tragic spike that's resulted from the pandemic measures. This has been felt across the country, felt very hard in British Columbia. Let me remind the member, we're the only province who has scaled up our response to the crisis across the full continuum of care. We have doubled the number of supervised consumption sites. We're the only province that's offering prescribed safe supply as a way to separate people from the toxic drug supply, and further expanding that. That we have built more treatment beds, doubled the number of youth treatment beds, that we are supporting in every way that we can to try to overcome this tragic loss of life. But honestly, I'm surprised, and with great respect to those families who have lost loved ones, and with great respect to those working hard to save lives, that the member would raise this question, questioning our commitment to addictions treatment and response to the overdose crisis in this week that the media is alleging that the BC Liberals used a publicly funded addictions recovery center for partisan purposes is troubling and questionable. And I hope the member does not question.
Member Chair would like to hear the answer, please. Minister will continue.
I've finished my answer, Minister. Thank you.
The bell ends the question period.